The purpose of this video is to give some low back pain tips. Short-term tips on how to relieve the pain and long-term tips on how to prevent it from returning. I'll start with a disclaimer. Keep in mind that I'm not your doctor or physical therapist. These are just general suggestions. If your pain is in what I call the severe domain, a 4 or greater on a 1 to 10 pain scale, or if you're experiencing sharp, stabbing, or burning pain, or numbness and tingling, you should seek out a medical professional. Or if the pain has lasted consistently for several months and doesn't alleviate with movement, you should seek out a medical professional. With that said, here are some short-term tips. You want to tackle this from 3 standpoints. First, trigger point release. A common culprit in low back pain is a muscle known as the QL, which stands for the quadratus lumborum. If you're mobile enough to get down on the floor, you can use a foam roller or a ball, such as a tennis ball or a lacrosse ball, to roll out the area like you see in this video. Roll for the purpose of finding areas where it feels like you're pressing into a bruise, and then hang out on or oscillate the area for 1 or 2 sets of 30 seconds to a minute. You may also want to use a tennis ball or lacrosse ball to roll your glutes and glute med, or gluteus medius, the side of your butt, like in this video. Try it out, and if you're feeling those bruise-like trigger points, do the same thing, 1 or 2 sets of 30 seconds to a minute, where you either hang out or oscillate the area. The second thing you want to address is areas of tightness. Upstream from your low back is your thoracic spine. Loosen this up by performing extensions over a rolled up bath towel or yoga mat, or over a half foam roller. Hang out for at least a minute. Gently perform seated rotations like this. And only rotate into a gentle stretch. If you feel any discomfort, terminate the stretch. Downstream from the low back, try these 3 stretches. A piriformis stretch while seated on a chair where you cross your leg, push the knee slightly down towards the floor, and then lean forward at the hip until you feel the stretch. Perform 1 or 2 sets for about 30 seconds on each side. If one side is significantly tighter than the other, place more emphasis on that side and perform an extra set. Next is a hamstring stretch. If you can't comfortably get into this stretch where your back is against the wall and your knees are straight, which means your hips are at a right angle, then you have tight hamstrings and need to work on this. Perfect world situation is that you can get into this position and lean forward to get further into the stretch. So if you're not able to do this, this should be a goal that you set for yourself over the course of time. Last is a hip flexor stretch. Place a towel or a pillow down if you don't have an Airex pad to create knee comfort on that side. Sit up tall and push your hip forward in space while you simultaneously squeeze your butt cheek. And continue to push forward until you feel a mild to moderate stretch in the front or upper part of your thigh. And then the third thing you want to tackle is strengthening with low back friendly exercises. Some safe examples are a bilateral bridge, or a single leg bridge if the bilateral version isn't challenging. Make sure you raise high enough that you feel your butt cheek or cheeks naturally contract, and then lower with control instead of plopping down. Core stabilizer exercises, such as one of these plank variations, and side plank variations, as well as one of these prone bird dog variations. Start with the elbows bent And if it isn't challenging enough, you can straighten your arms. And don't raise your thighs up off the ground too high. You'll feel several muscles working, but where you should feel it the most is the muscles directly in your low back. You should feel them working, but with no pain. And also this low back extension hold exercise. Only raise high enough that you feel your back muscles engage. There's no need to raise too high. Keep your feet down because raising them off the ground creates unneeded compression in your low back. A conservative core mover exercise, such as this modified crunch. Exhale on the way up and inhale on the way down. And then you also want to do something to strengthen the outside of your butt, such as this side lying leg raise with an ankle weight. Or this side stepping exercise with a TheraBand. If at the end of the set you didn't feel challenged, slightly increase the load until you find a weight that causes a little fatigue at the end of the set. Ultimately, you should keep in mind that to stave off low back pain so that it doesn't control your life, and in a perfect world, you want to do the following things. Take stretching seriously enough that you get rid of areas of tightness. Engage in a total body progressive strengthening program, because to decrease pain and the risk of injury, you need to optimize tissue strengthening, which means that you're eventually going to want to progress to exercises like hip thrusts, deadlifts, squats, and more advanced core and hip exercises with more variety, along with the rest of the major muscle groups in your body. But the suggested exercises in this video will get you started, and I'll leave some links to related videos which will help you progress. Please feel free to leave comments in the comment section, and I'll see you in the next video.